Stress echocardiography is a non-invasive diagnostic procedure that evaluates the heart's function and structures under stress, induced by either exercise or pharmacological agents. This powerful tool combines traditional echocardiography with physical or chemical stress to assess how well the heart pumps blood and how its structures function when the heart is working harder than usual. Stress echocardiography is widely used to diagnose coronary artery disease, CAD, by identifying areas of the heart muscle that do not receive adequate blood flow during stress. It helps detect significant blockages or narrowing in the coronary arteries. When part of the myocardium shows abnormal motion or decreased function under stress, it suggests ischemia, indicative of significant coronary artery stenosis. After a heart attack, stress echocardiography assesses whether regions of the heart muscle that aren't functioning normally are still viable. This is crucial in deciding whether procedures like revascularization, such as angioplasty or coronary artery bypass grafting, would benefit the patient. If an akinetic segment of the heart starts to contract under low doses of dobutamine, this suggests that the myocardium is still viable and could recover function if blood flow is restored. Stress echocardiography is essential in assessing valvular heart disease severity and its impact under increased workload. It helps determine whether valve dysfunction worsens with exertion, guiding treatment plans and decisions on surgical intervention. After a myocardial infarction, stress echocardiography stratifies the risk of future cardiac events. It predicts the likelihood of adverse outcomes based on heart performance under stress. For patients undergoing major surgery, it assesses the risk of cardiac complications, aiding in perioperative management. For patients with unexplained symptoms like chest pain or shortness of breath, stress echocardiography can clarify if these are heart-related, particularly when they occur during physical activity. By simulating exercise conditions, the test can confirm whether symptoms are due to myocardial ischemia or other cardiac conditions. Stress echocardiography is valuable in monitoring the progression of coronary artery or valvular disease over time. It helps assess whether the condition is stable, worsening, or improving with treatment. After interventions like angioplasty or valve replacement, it evaluates the effectiveness of the procedure and the current status of heart function. In hypertrophic cardiomyopathy, HCM, stress echocardiography assesses the degree of obstruction in the left ventricular outflow tract during exercise, guiding treatment. In dilated cardiomyopathy, DCM, it evaluates the heart's pumping ability under stress, determining the condition's severity and informing treatment plans. Stress echocardiography offers several advantages. Non-invasive. Unlike invasive procedures like coronary angiography, it reduces patient risk and discomfort. Real-time evaluation. It provides immediate imaging of heart function during stress. No radiation exposure. Unlike nuclear imaging stress tests, it doesn't expose patients to ionizing radiation, making it safer for repeated use. Widely available and cost-effective. It's a widely accessible and cost-effective option compared to MRI or CT scans. In summary, stress echocardiography is a versatile and essential tool in diagnosing, assessing risk, and managing various cardiovascular conditions. Its applications range from detecting coronary artery disease and assessing myocardial viability to evaluating valvular heart disease and guiding treatment decisions. The non-invasive nature, real-time imaging, and absence of radiation exposure make it a preferred diagnostic choice in many clinical scenarios.